Welcome back. This is the Weekend Report. I'm Masachaba Mposwa. South Africa's health sector continues to face challenges such as poor facilities and infrastructure, understaffing, and patient-to-health practitioner ratio imbalances, especially in the public sector. And while the National Health Insurance aims to deal with these challenges, there are still looming legal challenges, and experts believe that it will take years for the NHI to become operative. Adding to this, the recent withdrawal of foreign aid by the Trump administration will heavily impact the many strides made by researchers in fields such as HIV, TB, and cancer. And with tomorrow marking World Health Day, is access to healthcare a reality for the people of this country? South African Medical Association Board Chairperson Dr. Mvuyisi Mzukwa weighs in. Good morning, Doctor. Welcome to Newzroom Afrika.
Good morning to you, Chaba, and to your crew and your viewers at home. Thanks for inviting me.
As we know, Doctor, tomorrow is World Health Day. What are some of the key challenges facing healthcare systems in South Africa?
Well, I think, Chaba, to really understand the healthcare system, you've got to look at the 6 pillars of the healthcare system. That will really give you an overview of what you should expect as a South African. First is the issue of service delivery. Obviously, we understand that there should be a provision of a healthcare service that is effective. That's the first thing, but it must be safe. It must be of high quality. We must ensure equitable access, and also it must be affordable. And I must just say to you, Chaba, that none of the two systems are providing this, the public sector and the private sector. And the other pillar that you need to look at is the health workforce. You know, talking to healthcare workers. One, they must be well trained. Secondly, they must be motivated. But the issue of numbers come into play as well. We must have adequate staffing of a healthcare system. Then you come up with the what you call health information system. You know, you understand that we must do monitoring of outcomes. There must be planning of interventions, and also, you know, also obviously make informed decisions. The issues of access to essential medicines. You know that we're currently grappling with the numbers. Medicines are out of stock. There's also should be an issue of technology involved in that. Then the two last ones are the leadership and governance. This is a major hurdle, Chaba, that we're facing as a country, as you've heard from the report of the health ombuds. In fact, the two reports from the health ombuds talking about this issue of ethical leadership and governance. The last one that we're talking about is the issue of health financing, health system financing, where in South Africa we have chosen the National Health Insurance. I must say that, Chaba, that we must learn to differentiate between the universal health coverage and the NHI. The universal health coverage is where we want to be. The country, the world wants to be there. But how we get there depends on the country, whether they want to use a donkey, a horse, a plane, or they want to use a car or water transport. But it is the how part that we're talking about. And everybody in South Africa, the conversation that we're having is not about not wanting the universal health coverage. We are talking about how we're getting there. We don't agree on how we're getting there in terms of the NHI.
And Doctor, what would you say are the most pressing medical research priorities in South Africa?
Well, at the moment, we need to relieve the healthcare system. We do need to understand, first of all, the issues around socio-economic and political determinants of health. Because, Chaba, the first thing is that you don't want people to get sick. That's the goal. People must not get sick. We must look for factors that are causing people to get sick. Issues of poverty, we must address poverty. We must address education. We must address unemployment. Crime, we must deal with the issue of accidents, motor crashes and stuff like that. So those are the issues, so that we prevent this overload of the healthcare system or overburdening the healthcare system. But also, we must look at how we get our literacy levels to get up in terms of understanding, people understanding what it means to be healthy.
And what are your thoughts on the potential consequences of the NIH funding cuts for South African medical researchers, particularly in terms of ongoing projects and research capacity?
Well, it has serious implications. First of all, on how we manage HIV and AIDS, but also how we manage TB. But there's other issues, because there are training initiatives that have been started by our institutions within the country, training new scientists, but if we don't have that funding, because some of our colleagues are relying on this funding, so it means that we are taking a step back unless governments comes in and fills the gap in terms of this funding, because we cannot honestly continue to rely on foreign aid. As a country, there must come a time where we stand on our own and say we can do this with our resources within our means. So it is important that we recognize that we're a sovereign country. We don't depend on other countries. We must use our resources efficiently, dealing with the issues of corruption within our system.
And also, speaking of government, are you holding government accountable for the thousands of unemployed doctors?
It is a very serious matter that we are currently grappling with as the South African Medical Association. We've met with the minister talking about this matter of unemployed doctors, because like I said, these are well-trained, polished diamonds who are sitting there, whilst we have dire shortages, and the people that are within the system, the doctors that are within the system are struggling and are suffering from burnout. Some are struggling with issues of mental illness because of the exposure to being overburdened and stuff like that. So those are the issues that we're talking about. But the meeting that we're still waiting to have is the meeting with the Minister of Finance. We have written to the Minister of Finance so that we understand where are the problems. But also, even regarding the allocation of the funds to the provinces, provinces do get money from from Treasury. But the problem is that there's no ring fencing of these funds to tell provinces that you can't use this. It must be allocated under conditions to say this is for the employment of healthcare workers and nothing else. Because if you don't do that, provinces will continue to use these funds, for their own priorities.
All right, Doctor, on that note, let's talk about the staff issues in greater detail. Almost half of the clinics reported never being visited by a doctor. Over 2/3 couldn't offer dental care. What do you believe contributes to these issues, especially considering that there are qualified doctors actively seeking employment?
Well, the greatest problem is poor planning and leadership by our government, because you'll recall that government has not been coordinating the training of healthcare workers, especially doctors. You'll find that each province is sending people or students to many different countries, and there was no talking to what is going to be happening in the future, how many doctors we need in the future. People were just training willy-nilly, and there was no coordination. At some point, you'll remember we had students that were stuck in Russia, and there was no funding for them, and they were stuck in that country. So you can imagine that poor coordination. So this is what is a serious problem now, because we've got this number of doctors who are sitting at home unemployed, but we've got so many shortages in the healthcare system. People are telling us that there's no funding, a concept that we don't agree with, Masichaba, because you'll recall that we're dealing with serious issues of corruption. Between just 2009 and 2013, we lost about 24 billion rands to corruption, and we're still investigating money that was lost during the times of COVID. Tembisa alone, we're still investigating 3.4 billion. You can imagine the inefficiencies and the loss, of this funding in the system itself in terms of corruption. So we do need to put our house in order if we are to deal with the issue of unemployment.
Doctor, let's talk about the availability of medicine and supplies. I mean, what are the main challenges in ensuring the availability of essential medicine in public health facilities? And how can supply chain management be improved to ensure timely delivery of medicine?
I think this one is a very serious problem because it affects everyone. It affects, doctors and nurses who've got to attend to that person who's not feeling well, but also in terms of emergencies. If you do not have emergency medicines like adrenaline, you can imagine what is going to happen when you resuscitate a dying patient. So, and this is one of the reasons that are putting pressure on the side of the healthcare workers, because if you are there in your own body, but you don't have equipment and essential medicines, then there is nothing that you're doing. So the issue of procurement is something that we need to deal with decisively. Like we said in our proposal, the Universal Health Access Coalition proposal, the issue of leadership is what we need to deal with, because it impacts on procurement as well. If we don't deal with the issue of ethical leadership and coordination of the healthcare system, because those people don't only coordinate the healthcare system, but also they make sure that there's accountability within the system. If that is not the case, then I don't think we are going to win the battle.